Good day everyone, I am Ting Mahalehem and now I will discuss the functions, skills, and rules of social work in different settings. Each setting demands a unique combination of skills, but all social workers share a commitment to advocating for and supporting individuals and communities in needs. Social workers in these various settings must adapt their skills and knowledge to meet the unique needs of the populations they serve, always with a focus on promoting well-being, social justice, and human rights. Here are the 10 characteristics and skills of successful social worker. Number 1, empathy. Number 2, communication, organization, critical thinking, active listening, self-care, cultural competence, patience, professional commitment, and advocacy. And now, let's move to the main topic, the functions, rules, and skills of social worker in different settings. The first settings is hospitals or medical social work. The functions in these settings is assess patients, psychosocial needs, coordinate discharge, planning and post-hospital care, advocate for patients' rights and access to resources. The roles is patient advocate, case manager, crisis intervention specialist, and the skills in these settings is knowledge of healthcare systems and medical terminology, crisis intervention and trauma counseling, advocacy and negotiation, interdisciplinary collaboration. The next settings is court or forensic social work. The functions in these settings is assist in child custody evaluations, provide expert testimony and legal access, legal cases, conduct risk assessments for offenders, and support victims and perpetrators in the justice system. The roles is expert witness, mediator in disputes, case investigator, rehabilitation counselor for offenders. The skills is knowledge of legal systems and court procedures, interviewing and report writing, risk assessment and forensic evaluation, and lastly, mediation and conflict resolution. The next settings is welfare institution or community social work. The functions in these settings is develop and manage social welfare programs, advocate for vulnerable populations, conduct needs assessment and provide resource, referrals, and lastly, monitor compliance with welfare policies. The next is the roles in these settings is policy advocate, case manager for individuals in need of assistance, program developer and coordinator, and outreach worker. The skills in these settings is program development and evaluation, resource coordination and case management, community outreach and organizing, advocacy and policy development. The next settings is school or school social work. The function is address students' social, emotional, and behavioral issues, provide individual and group counseling, support at-risk students through crisis intervention, coordinate with teachers, parents, and administration. The roles of social work in here is counselor and mental health support, advocate for student needs, conflict mediator among students, teachers, and families, and case manager for special education or at-risk students. The skills is counseling and emotional support, behavioral intervention and management, advocacy for student welfare, and lastly, collaboration with educational professionals. The next settings is church or faith-based social work. The functions is provide counseling based on spiritual and emotional needs, develop faith-based community programs, support congregants in crisis situations, address issues such as addiction or family conflict within the faith community. The roles of social worker in these settings is counselor with a faith-based perspective, community organizer for church-based services, spiritual support and guidance provider, advocate for social justice through a faith-based lens. The skills is spiritual counseling and guidance, program development for faith-based services, crisis intervention in faith-based settings, and understanding of religious and cultural dynamics. The next settings is military or military social work. The function is provide mental health support for active duty personnel and veterans, address issues like PTSD, trauma, and family reintegration, support service members through transition, and advocate for veterans' benefits and services. The rules is mental health counselor for military personnel and families, advocate for military and veteran services, crisis intervention specialist, and transition support coordinator. The skills and the settings is trauma-informed care and PTSD counseling, familiarity with military culture and systems, advocacy for veterans, benefits and services, and lastly, crisis intervention and stress management. And the last settings is industrial or corporate settings or occupational social work. The functions is address employee mental health wellness, develop employee assistance programs, mediate workplace conflicts, and promote diversity, equity, and inclusion initiatives. The roles is employee assistance program, counselor, mediator for workplace issues, trainer or facilitator for mental health and DEI programs, and lastly, advocate for employee rights and wellness. The skills in the settings is conflict resolution and mediation, program development for employees' wellness, counseling and support for workplace stress, and organizational development and change management. Social workers have a broad range of professional duties and responsibilities that aim to improve people's well-being. While roles vary, core social work activities involve assessing needs, building relationships, advocating, counseling, case management, and intervening. In crisis situations, social workers perform these duties in diverse settings like schools, hospitals, communities, and government agencies. They work with population of all ages and background. That's all everyone. Thank you. Thank you for watching and listening this video.